7 symptoms of heart failure most people ignore. If your shoes have felt a little tighter by the end of the day, or you have found yourself resting halfway up the stairs when you never used to, please keep watching, because what we are about to share could matter more than you think. Most people believe heart failure means the heart has stopped working completely. That is not true, and this single misunderstanding causes millions of people, right now, in their 70s and 80s, in their favorite recliners and kitchens, to miss the earliest warning signs their own body is quietly giving them. Before we go further, please remember that this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If anything in this video sounds familiar to you or someone you love, please speak with a qualified healthcare professional. Heart failure does not mean the heart suddenly quits. It means the heart is struggling to pump blood as efficiently as it should, and that struggle almost always whispers long before it ever shouts. The tricky part is that these early whispers rarely look like a heart problem at all. They look like tiredness after a long day. They look like a shoe that fits a little tighter than it used to. They look like ordinary aging, the kind we have all been told to simply accept. And that is exactly why so many people, and even a few doctors during a rushed appointment, brush them aside without a second thought. According to the American Heart Association, roughly 6 million adults in the United States are living with heart failure at this very moment, and many of them spent months, sometimes years, dismissing the exact signs we are about to walk through together. Over the next few minutes, we are going to cover 7 of those signs, one at a time, in plain and simple language. Some of them will sound familiar right away. But one of them, saved for later in this video, is so easy to dismiss that most people mention it to their family or their doctor almost as an afterthought, if they mention it at all. And by the time we reach it, you will understand exactly why it deserves so much more attention than it usually gets. Age plays a real role here, and there is no reason to tiptoe around that fact. The heart, like every other muscle in the body, can gradually lose some of its natural elasticity and strength over the decades, which means the signs we are about to cover tend to appear more often, and more noticeably, after the age of 65. That does not mean getting older automatically leads to heart failure. It simply means that paying attention to your body becomes more valuable with each passing year, not less. Many of the people watching this video today have already lived through decades of doctor visits, health scares, and false alarms, and it is completely understandable to feel a little worn out by health warnings in general. But this particular set of signs is different, because unlike so many vague wellness trends, these 7 signs are directly tied to how efficiently your heart is moving blood through your body, and recognizing them early genuinely does make a difference in how they can be managed. Let's begin with something almost everyone has felt at some point in their life, but which can mean something very different when it starts happening more often than it should. Number 1, unusual fatigue that does not match your effort. Feeling tired after a long shift, a poor night of sleep, or an intense workout is completely normal. What is not entirely typical is feeling drained after simple, everyday tasks that never used to bother you. Carrying groceries up the stairs, making the bed, walking from the parking lot into the store. When the heart is not pumping blood efficiently, the muscles and organs throughout the body receive less oxygen than they need, and the brain responds by making you feel exhausted, even when you have not done very much at all. Margaret, a 71-year-old retired schoolteacher from Ohio, described it this way to her daughter. She said gardening, something she had done every weekend for over 30 years, suddenly felt like climbing a mountain. She assumed it was simply her age catching up with her. It took several months, and a conversation with her daughter, who noticed she was resting on the porch far more than usual, before Margaret finally brought it up during a routine checkup. Her experience is incredibly common, and it illustrates exactly why this sign gets overlooked. Fatigue is quiet. It does not announce itself. It simply becomes the new normal, one small adjustment at a time, until the person barely remembers what their old energy level felt like. What makes heart-related fatigue different from ordinary tiredness is the pattern. It tends to build gradually, it does not improve much with rest, and it often shows up alongside other changes in the body. A helpful way to think about it is comparing today to a year ago. Could you climb a single flight of stairs without pausing 12 months ago, and now find yourself stopping halfway to catch your breath? Did a short walk around the block once feel effortless, and now leave you searching for the nearest bench? These comparisons matter far more than comparing yourself to someone else your age, because every person's baseline is different, and the most meaningful clue is often a change from your own normal, not a comparison to anyone else's. It is also worth mentioning that this kind of fatigue can sometimes be accompanied by a general sense of heaviness in the arms and legs, almost as though you are moving through water rather than air. Some people describe needing to sit down partway through a task they used to complete in one continuous motion, like vacuuming a single room or washing a sink full of dishes. None of this, on its own, confirms anything serious. But noticing it and mentioning it out loud to someone is the first and most important step, which brings us to a symptom that many people notice but almost never connect to their heart. Number 2, swelling in the legs, ankles, or feet. When the heart cannot pump blood forward with its usual strength, blood can back up in the veins, and fluid gets pushed out into the surrounding tissue. This often shows up first in the lower body, simply because gravity pulls that extra fluid downward throughout the day. You might notice your socks leaving a deeper indentation around your ankles than before, or your shoes feeling snug by the evening, even though they fit comfortably in the morning. This kind of swelling, which doctors sometimes call edema, is frequently mistaken for a sign of standing too long, eating too much salt, or simply getting older. And to be fair, those factors can absolutely contribute to swelling as well, which is part of why this sign is so easy to explain away. The distinguishing detail is persistence and progression. Swelling that shows up most days, that seems to be getting a little worse over weeks or months, or that comes with an unusual and sudden increase in body weight, may be worth discussing with a healthcare professional, since sudden weight gain can sometimes reflect fluid the body is retaining rather than fat. One simple habit that many cardiologists recommend is weighing yourself at roughly the same time each morning, before breakfast, and keeping a small written note of the number. A gain of 2 or 3 pounds in a single day, or 5 pounds within a week, without any change in eating habits, is the kind of detail that is easy to miss in the moment, but incredibly useful to share with a healthcare professional later. It is also worth noticing whether the swelling shows up in both legs evenly or seems isolated to just one side, since that distinction can sometimes point toward different underlying causes. Pressing gently on the skin above your ankle bone and watching whether a small indentation lingers for several seconds is another simple way to notice this kind of fluid retention before it becomes obvious to the eye. There is also a quieter version of this symptom that catches people off guard, and it happens at night, in a place most of us never think to look for heart trouble. Number 3, shortness of breath, especially when lying down. Most people expect breathlessness to show up during exercise, and it certainly can. But one particular pattern deserves special attention: difficulty breathing that appears or worsens specifically when lying flat, sometimes forcing a person to prop themselves up on extra pillows just to feel comfortable enough to sleep. Doctors sometimes refer to this as orthopnea, which simply means breathing difficulty that happens when lying down and tends to improve when sitting up. This happens because lying flat allows fluid to redistribute and settle into the lungs more easily when the heart is not pumping efficiently. Robert, a 68-year-old retired mechanic from Pennsylvania, mentioned to his wife that he had quietly started sleeping in his recliner most nights because lying in bed left him feeling like he could not catch his breath. He assumed it was simply his allergies acting up, or perhaps the mattress needed replacing. It was actually his wife who insisted he mention it to his doctor, and that single conversation opened the door to an evaluation that might not have happened otherwise. There is an even more specific version of this pattern that doctors watch for closely, sometimes called paroxysmal nocturnal dyspnea, which simply describes sudden episodes of breathlessness that wake a person from sleep. usually an hour or two after lying down, forcing them to sit upright or walk to an open window before the feeling passes. It can be frightening in the moment, and many people quietly convince themselves it was simply a bad dream or a moment of anxiety, especially if it does not happen every single night. But an episode like this, even if it only happens occasionally, is a meaningful detail worth remembering and mentioning, because it reflects something specific happening inside the body rather than a random occurrence. If you find yourself needing more pillows than you used to, or waking up gasping for air in the middle of the night, these details matter, and they are worth sharing with a healthcare professional rather than adjusting your sleep setup and moving on. Speaking of things people quietly adjust around rather than question, there is a next sign involving something as ordinary as a persistent cough. Number 4, a persistent cough or wheezing that will not go away. An occasional cough is nothing unusual, especially during allergy season or after a cold. But a cough that lingers for weeks, sometimes producing white or pink tinged mucus, and that comes with a wheezing sound, can sometimes point toward fluid accumulating in the lungs, a condition sometimes called pulmonary congestion. This happens for a similar reason to the breathing difficulty we just discussed. When the heart struggles to keep up, fluid can back up into the lung tissue, and the body responds with coughing as it tries to clear that fluid. This sign is particularly easy to dismiss because it so closely resembles a common cold, bronchitis, or seasonal allergies, all of which are far more common explanations for a cough. That overlap is exactly why many people wait it out with cough drops and home remedies, rather than seeking medical attention. James, a 66-year-old retired firefighter from Texas, mentioned that his wife kept buying him different brands of cough syrup for nearly 2 months, convinced it was simply a stubborn case of allergies that would not clear up. It was not until the cough started interrupting his sleep, layered on top of the ankle swelling he had already been noticing, that he finally scheduled an appointment rather than reaching for another bottle off the pharmacy shelf. If a cough persists for more than a few weeks, especially alongside any of the other signs we have already discussed, it may be worth mentioning to a healthcare professional rather than assuming it will simply pass on its own. Now here is where we reach the sign that surprises almost everyone, the one we mentioned earlier in this video, because it has nothing to do with breathing, swelling, or fatigue at all, and it involves the stomach. Number 5, loss of appetite, nausea, or a feeling of fullness. This is the sign most people never associate with their heart, and honestly, it makes sense why. When someone thinks about heart problems, they picture chest pain or shortness of breath, not digestive discomfort. Yet when heart function declines, blood flow to the digestive system can be reduced, and fluid can build up around the liver and intestines, creating a sensation of fullness even after eating very little. Some people describe feeling nauseated for no clear reason, or simply losing interest in food they used to enjoy. Dorothy, a 74-year-old grandmother from Georgia, told her family she just was not hungry anymore, and that everything seemed to fill her up faster than it used to. Her family assumed it was related to her medications or simply a natural part of aging, which are both reasonable and common explanations. It was not until she also mentioned some mild swelling in her ankles during a visit with her cardiologist that the pieces started to come together. On their own, digestive changes rarely point clearly toward the heart, but when combined with other signs on this list, they can become part of a much more meaningful pattern, which is exactly why healthcare professionals often ask about several symptoms together rather than looking at just one in isolation. There is also an interesting and somewhat counterintuitive detail worth knowing about this particular sign. Some people, especially in more advanced stages, experience noticeable weight loss rather than weight gain, simply because they are eating so little that their body begins drawing on its own reserves. This can create a confusing picture where someone appears to be shrinking overall while still retaining fluid in their legs or abdomen, which is part of why digestive symptoms are so often the last piece of the puzzle that finally connects everything else together for a healthcare professional. If eating has started to feel like a chore rather than something enjoyable, and that change has lasted more than just a few days, it is worth mentioning during your next appointment, even if it feels unrelated to anything else on this list. This overlapping pattern becomes even clearer with our next sign, one that affects something as simple as the rhythm inside your chest. Number 6, a rapid, irregular, or noticeably fluttering heartbeat. Most of us have felt our heart race after a stressful moment, too much caffeine, or a startling surprise, and that is completely normal. What is different is a heartbeat that feels irregular, that skips or flutters without an obvious trigger, or that races even during quiet moments of rest. When the heart is not pumping efficiently, it sometimes tries to compensate by beating faster or less regularly, which can feel like a fluttering sensation in the chest, sometimes described as palpitations. This sign can be especially unsettling because it is so noticeable in the moment, yet so easy to forget about once it passes. Many people mention feeling their heart flutter for a few seconds, only to feel completely fine minutes later, which leads them to assume it was simply a passing moment of stress or too much coffee. Linda, a 69-year-old retired nurse from Florida, of all people, admitted that she brushed off her own fluttering sensations for nearly a year, assuming that her decades of medical experience meant she would simply recognize something serious if it were happening. She later reflected that this assumption was exactly what delayed her own evaluation, a reminder that even those with medical backgrounds are not immune to dismissing their own bodies. Doctors sometimes refer to one particular type of irregular rhythm as atrial fibrillation, which describes the upper chambers of the heart beating out of coordination with the lower chambers. This condition can exist on its own, but it can also develop alongside heart failure, and each can make the other more difficult for the body to manage. However, when these episodes happen repeatedly, or last longer than a few seconds, they may be worth mentioning to a healthcare professional, since an irregular heart rhythm can sometimes be connected to how well the heart is functioning overall. There is one more sign left, and it is perhaps the most misunderstood of all, because it involves something most people believe has nothing to do with the heart whatsoever. Number 7, confusion, difficulty concentrating, or memory changes. When the heart cannot deliver enough oxygen-rich blood to the brain, cognitive function can be affected in subtle but noticeable ways. This might look like difficulty concentrating on a task that used to feel effortless, occasional confusion, or a general sense of mental fog that seems to come and go. In older adults, this sign is particularly easy to mistake for normal aging, or even for early memory concerns unrelated to the heart at all, which means it is frequently overlooked or attributed entirely to something else. Harold, an 82-year-old retired postal worker from Michigan, began forgetting small details during conversations with his grandchildren, things he would have remembered easily just a year earlier. His family worried it might be related to memory changes associated with aging, and scheduled an appointment with his primary care doctor. During that visit, several of the other signs we have discussed today, including subtle swelling and mild breathlessness, were also identified. This particular sign is also worth mentioning because it is so often noticed by family members before the person experiencing it even realizes anything has changed. A son who notices his father repeating the same question twice within a single phone call, or a daughter who notices her mother struggling to follow a recipe she has made 100 times before, may be picking up on something meaningful, even if the person themselves feels completely fine. If you are watching this video because someone you love has been acting a little different lately, mentioning your observations gently, without alarm, can be an important first step toward getting them the evaluation they may need. Harold's story is a powerful reminder that cognitive changes should never be assumed to have only one explanation, and that a thorough evaluation by a healthcare professional can help clarify what might actually be happening. It is also worth knowing that certain factors tend to raise the likelihood of these signs being connected to the heart, rather than something else entirely. A history of high blood pressure, diabetes, a previous heart attack, or long-term smoking can all place additional strain on the heart over the years, making it more likely that fatigue, swelling, or breathlessness are related to how the heart is functioning rather than a separate, unrelated cause. None of these factors guarantee anything on their own, but if one or more applies to you or someone you love, the 7 signs we have covered today deserve just a little bit more attention, not less. Taken together, these 7 signs rarely appear all at once, and having one of them certainly does not mean heart failure is present. Fatigue, swelling, breathlessness while lying down, a lingering cough, appetite changes, an irregular heartbeat, and shifts in concentration can each have many different explanations. What matters most is paying attention to patterns, to combinations, and to changes that persist and gradually worsen rather than come and go. According to the American Heart Association, roughly 6 million adults in the United States are currently living with heart failure, and that number continues to grow as the population ages. Perhaps even more striking is that early recognition and timely medical care can meaningfully improve quality of life and outcomes for people living with this condition. That statistic alone is a reminder of just how many people are quietly navigating these symptoms without realizing what they might mean. It is also worth knowing the difference between a sign that deserves a scheduled conversation and one that deserves immediate attention. Sudden, severe shortness of breath that comes on quickly, chest pain or pressure, or fainting should always be treated as an emergency, and calling 911 or having someone take you to the nearest emergency room is always the appropriate response in those moments. The 7 signs we covered today tend to build gradually rather than appear suddenly, which is exactly why they are so easy to overlook. But that gradual nature also means there is usually time to have a calm, unhurried conversation with your doctor, rather than waiting for an emergency to force the issue. If any of these 7 signs sounded familiar, whether for yourself or for someone you care about, please consider having an open conversation with a healthcare professional. Early attention rarely hurts, and it can make a meaningful difference, not just in how long someone lives, but in how comfortably and fully they are able to live it. We would love to hear from you in the comments. Has anyone in your life experienced one of these signs without realizing what it could mean? Or is there a sign from today's list that you have never heard connected to the heart before? If you found this video helpful, please consider sharing it with a parent, a spouse, or a friend who might need to hear this today. Since a single conversation started because of a video like this one has, for many families watching right now, made all the difference. And if you would like more clear, compassionate health education like this, delivered in the same straightforward way, we would be truly grateful to have you subscribe for what comes next.